The Prime Minister says IVF should not be considered elective under COVID-19 rules, despite the Victorian government putting a temporary ban on fertility treatments. The decision to halt the treatments until April of this year, due to the surge of Omicron cases, has been met with backlash, with a petition calling to reinstate the treatments reaching nearly 98,000 signatures. Mr Morrison says while he respected Victoria's decision to put a temporary halt on IVF treatments, the view of National Cabinet was that such treatments are not elective.
Earlier on in the pandemic, we exempted IVF treatments as being elective procedures, and that remains my view. There's no choice involved in infertility treatments. It's not an elective procedure in my view.
To talk more on this is Sarah Carter, the Deputy Mayor of Maribyrnong in Melbourne. Hi Sarah, how are you?
Hi, good, thank you.
Sarah, personally, you know only too well the IVF process, the heartbreak that comes with it as well. What is your reaction to the Victorian government's decision?
Yeah, it's devastating. I do understand the pressures that are on the public health system at the moment, but as someone who's currently mid-cycle, I'm pumped full of hormones right now. I'm feeling quite guilty because I'm one of the ones that made the cutoff. I really feel for the women and the families. It's a very small and tight-knit community, the IVF community, that this decision still stands and that it hasn't been reversed, because I feel very strongly that it's a misstep at this time, because certainly IVF is not elective.
And that's the thing, the Prime Minister has said it, countless people on social media have said it. This is not a choice that people make, and a lot of other elective surgeries beyond the IVF realm as well. No one's choosing or wanting to go in for these procedures. They are needed.
Absolutely. I mean, I tried naturally. It's been a 2-year journey for me. I had 2 miscarriages the year before last before seeking IVF treatment. There's no other option for me, and I'm of advanced maternal age. So really time is ticking away. And with this suspension on IVF services, by the time we're able to resume, if this cycle doesn't work for me, I'll be in my 43rd year. And there's literally a small percentage of an already tiny percentage of this working that slips away. It literally evaporates in that time. And I know that there's, unintended consequences of the ban on elective surgeries. And I think that's what this is. I'm a proud member of the Labor Party. But I do think that this is one of those unintended consequences, and it's something that does need to be corrected.
Now, that's the thing. With IVF, time is a luxury, really, at the end of the day, isn't it?
I don't have time. There's so many of us. We probably haven't slept very much in recent days. The cumulative stress of it. And also we all reach out to each other, those that are going through this. As I said, I'm lucky to have made the cutoff, but I was up until 4 a.m. thinking about what if this doesn't happen? If this doesn't work, I'll be 43 before we get to try again. So I do think, and I think one of the things that's been really frustrating is in speaking to medical directors. It's something that I did my own due diligence before deciding to speak out. In speaking to medical directors that facilitate IVF, they absolutely believe that this treatment can be accommodated even with the current pressures on the system, without the affecting the treatment of COVID patients.
Just before I let you go, as you said, you are a Victoria Labor member, and proudly so. What is your message to the Premier, to the Victorian government, on behalf of so many women, so many families, so many couples? Yeah,
absolutely. And I mean, I do think there's a broad recognition and understanding, and I was encouraged by the Deputy Leader Molino's comments yesterday about, the acknowledgement that this is time sensitive and time bound, and it's such an important issue to so many women. We do not choose to be struggling with infertility. We don't choose these treatments. This is the only option we have, and time literally evaporates with every single cycle. So my plea would be, as a proud Labor woman, these unintended consequences can be corrected. And, you know, I would, you know, encourage Daniel Andrews to speak to some of the fertility directors that I'm speaking to. You know, Lynn Burmeister, who's been speaking out, she's a national treasure. Like, speak to her. There's a way to do this, and we really have to make this work, because there are so many families, so many women, so many family units with many complexions, and by extension, sisters, grandparents, you know, who are all invested in this, and it's absolutely not elective.
Sarah Carter, thank you so much for your time and for sharing your story and for speaking out about this. We really appreciate it.
Thank you for having me.